Uganda has marked the World Tuberculosis Day with calls to invest more in health service delivery in order to end tuberculosis by 2030. This as Uganda is said to be registering over 90,000 cases of tuberculosis annually, of which 10% end up losing their lives due to failure to access medication.
The World Tuberculosis Day commemoration in Butaleja that attracted a huge population across the country began with a screening of suspected TB patients, where close to 3,000 people underwent medical examination in an attempt to identify the new cases. With over 90,000 people in the country believed to be infected by the airborne disease annually, tracing other victims remain a huge challenge in the TB fight.
And it's more pronounced in such a sub-region where the terrain is quite difficult. The roads, the infrastructure is quite poor. So we need to make sure that we're able to increase the access of services.
That's why the ministry has come up with what we call the CAST program, the community awareness and screening and testing. So where we move to the community so that we can be able to get these cases. So we do this 2 times each year.
Besides these challenges, difficulties in accessing treatment by the patients is yet another obstacle towards its elimination from the communities.
You find that they go to the hospital, sometimes they tell them that the medicine is not there. So when they tell them and they are referred to Mbale, and some of our people are not having transport, they cannot move to Mbale. So the disease ends up eating them.
What you need is just to drop a sample at the health center free, and the sample can be picked from there with somebody who rides a motorbike, and then it can be delivered where it can be tested, and the results can be sent back.
With Uganda's mission to eliminate tuberculosis by 2030, leaders say this can only be realized if more is invested in the health sector by government.
So that when our people go to health centers, they are able to get treatment. And more especially when you come to areas which are in villages, many of the patients go to health centers and they are referred to regional referral hospitals. And we find that many of our people are still living below the poverty line.
The referral hospital is one of the accredited centers where TB services are provided, but that's not sufficient. You want to make sure that the services go up to a level of health center 3 as much as possible. That calls for increased support, increased resources. You need to have the human resources at such a level to provide those services.
The third Deputy Prime Minister, Lukia Nakadama, who represented government at the event, said a lot is being done towards the fight against the spread of the disease.
The Office of the Prime Minister, together with the Ministry of Health and launched a multi-sectoral accountability framework for TB in November 2020. These and many other policies should not be shelved.
According to the report released by the World Health Organization in 2021, Uganda remains among the 30 most tuberculosis-hit countries in the world, registering over 300 cases daily, on which 10% end up losing their lives. Victoria Bagaya, David Ocheng, NBS, Live at 9.